Driving under the influence of prescription and OTC drugs, Part 3. Driving ability and prescription CNS depressants. The central nervous system is slowed down by all depressive drugs. Every medication in this class has the potential to result in significant sleepiness, delayed movements, and decreased cognition, albeit the side effects differ from drug to drug. Even when these side effects are minor, they greatly increase your chance of falling asleep at the wheel or missing crucial details about the traffic situation. Additionally, because of the slowed reaction time, you can find it difficult to adapt to changes in the road environment in time to prevent collisions and confrontations. Z drugs have a reputation for substantially affecting a driver's ability to drive, even when only minute amounts of the drug are present in their system. It can be particularly challenging for a patient to decide if they can safely operate a vehicle because these medications frequently have a delayed impact. Unsurprisingly, one of the most frequently discovered substances in drivers who have been detained for driving while under the influence of narcotics is zolpidem, which is routinely prescribed. Stimulants for the central nervous system. Attention deficit hyperactivity disorder, ADHD, chronic fatigue, morbid obesity, narcolepsy, and severe depression are all routinely treated with prescription CNS stimulants. After just a few usage, many strong stimulants can lead to physical addiction and psychological dependence. Unfortunately, due to the temporary high-end energy boost they offer, prescription CNS stimulants are commonly misused. Most stimulants are quickly tolerized by patients, requiring progressively greater doses to produce the same early effects. The following is a list of some of the most popular CNS stimulants. Typical CNS stimulants: dextroamphetamine, dexedrine, amphetamine and dextroamphetamine mixed, Adderall, methylphenidate, Ritalin or Concerta, methamphetamine, digoxin. More than 16 million Americans over the age of 18 were discovered to be using prescription stimulants, according to a 2016 research by the American Journal of Psychiatry. Data from the same paper also raises the alarming possibility that 5 million Americans are abusing prescription stimulants for weight loss and performance enhancement, with Adderall being one of the most widely utilized examples. The following are a few impacts of prescribed stimulants: dizziness, insomnia, elevated blood pressure, rapid, shallow breathing, irritability, depression, anxiety, paranoia, headaches, spasms of muscles, tremors, manic episodes and mood swings. Driving ability and premium CNS stimulants. The National Highway Traffic Safety Administration's research demonstrates that little doses of CNS stimulants, such as amphetamines, can increase drivers' alertness and quickness of reaction. Unfortunately, the study's relatively low doses also increase drivers' propensity to act recklessly or riskily when operating a vehicle. The marginally beneficial effects of CNS stimulants on driving ability vanished at larger doses and were replaced by markedly unfavorable ones. High amounts of stimulants cause drivers to lose focus, react slowly, have difficulty controlling their muscles, have poor motor skills, feel more anxious, and take longer to react overall. Stimulant abuse, such as utilizing Adderall, Concerta, or Dexedrine, can lead to risky driving habits. These drugs frequently cause people to drive recklessly, disrespect traffic signs and signals, go too fast, and fail to maintain a safe following distance. Over-the-counter, OTC, medicine hazards. You don't need a prescription to get a lot of pharmaceuticals and generic medications. Certain pharmaceuticals may occasionally have age restrictions or caps on the quantity that one person can buy at a time. Drugs that are sold without a prescription often have a very minimal risk of addiction and abuse. They frequently do include addictive and dangerous medicines, but only in little, safe dosages. Without a prescription, you can get cough suppressants, painkillers, allergy medications, stomach acid reducers, and moderate sedatives. OTC medications can nevertheless have unfavorable side effects that can have a negative influence on your health and ability to drive safely, despite the fact that they are typically less risky than prescription-only medications. Serious adverse effects often only happen when OTC medications are taken in extremely high amounts. However, if a person is sensitive to a certain chemical, they could experience negative effects even at relatively modest levels. Never exceed the maximum dose specified on the packet of any OTC medication you are using. Always read the label. Keep in mind that every person reacts to medications differently. Even though the directions on the packet say you can drive while using the medication, be sure you're in good physical and mental health first. Whenever possible, look for an alternate mode of transportation.